Thank you, Chair Murray and Vice Chair Collins, for your leadership in ushering all 12 appropriation bills through the committee this year. And Chair Murray, I would be remiss if I didn't say that I have some big tennis shoes to fill as I succeed you in the gavel of this important subcommittee. I also want to thank Senator Capito for your approach, for your cooperation, and all your involvement personally in developing this bill. The Labor HHS bill that we're marking up today funds a wide range of important priorities, from substance use disorder and mental health programs, to child care, to biomedical research, to workforce development. And this year, we received 9,185 programmatic appropriation requests from senators for important programs throughout the bill. It's a difficult endeavor in any year to put this bill together, but this year the bill was even harder to write because of the cuts Congress agreed to in order to not default on our debt and crash our economy. As a result, this bill includes less funding than it did in the current fiscal year. Of the nearly 10,000 requests I just referred to, I can count on one hand the number of those requests from senators that asked us to reduce funding for a program. The bill is very much a compromise, but despite the challenges we faced in writing this bill, I am very proud of our finished product. We looked hard at every program and worked together to address the highest priority funding needs. This bill invests an additional $1 billion to increase access to early childhood care and education programs, and provides $943 million more for NIH to support life-saving biomedical research. In a bill that overall includes less funding than the current fiscal year, this bill provides $100 million in increased funds for mental health research, $100 million in increased funding for Alzheimer's disease research, and a $60 million increase for cancer research, among other increases for important programs. While our country grapples with deadly poisonings and overdoses from fentanyl, we boosted our investment in programs that are helping our communities save lives. This bill includes nearly $300 million in increased funding for substance use disorder and mental health programs that provide critical support for those struggling with substance use disorders and mental health challenges. And as an increasing number of individuals, and especially our nation's youth, are seeking crisis care, this bill includes an $18 million increase for the 988 Suicide Prevention Lifeline. It includes targeted increases to other programs, including curbing maternal mortality, ending the HIV epidemic, boosting career and technical education, and supporting pandemic preparedness and biodefense, while maintaining the vast majority of investments made in important programs over the last couple of years. I am so proud of the investments that we were able to make in this bill, but I wish we could have done more. I'm disappointed that this bill isn't able to increase funding for family planning, among many other important programs. But this bill makes the most out of the hand that we were dealt in our bipartisan compromise to avoid defaulting on our nation's debt. And in stark contrast to the Labor HH bill being fashioned in the House of Representatives, this bill was developed in a fully bipartisan manner. The House process threatens a government shutdown and sequestration to defense and non-defense programs. This bill can be passed by the Senate, passed by the House, and signed by the President. And finally, I want to acknowledge the exceptional work done by our staff that helped every day and night putting this bill together. And that includes my staff on the majority, Kelly Brown, Mike Gentile, Abby Laver, Mark Leish, Megan Mott, Catherine Tumajian, and Senator Capito's staff on the minority, Ashley Palmer, Tom Pfeiffer, Lindsay Seidman, and Emily Slack. And I also want to thank all of the other staff on the committee and at GPO and at CBO and my own personal staff who have worked long hours to get us to this point. This is a good bill, and I'm proud to have my colleagues' support for it.
Thank you. Senator
Now-
Capito?
Thank you, Madam Chair and Vice Chair. And in the interest of time, I'll go quickly, but I would like to make a statement because as Senator Baldwin said, this has been a difficult exercise for us, but I think we've come up with a very good solution. So I want to thank you both for your leadership at the top of the committee, because we are proving that regular order is not just important, it is doable. And the fact that we are even considering this bill, perhaps more than others, proves that it can be done. The Labor and HHS Appropriations bill is one of the most difficult appropriations bill and is the largest non-defense discretionary bill. This is the first year that Senator Baldwin and I have worked together. We've worked together on many other issues, but she and her staff have just been a joy to work with, and I thank her for her steadfastness, her great ideas, and her willingness to reach agreement where it looked like maybe we were going to have a lot more difficulty. So I'm pleased to be able to present this bipartisan bill. While we each approached the bill differently, it was important to present a bipartisan result, including member priorities such as greater investments in biomedical research, pandemic preparedness, mental health, child care, education, workforce development, and efforts to combat the opioid epidemic. With the fiscal year 2024 Labor H bill, we were faced with a difficult fiscal reality than the last few years of almost across-the-board funding growth. This is the first bill since 2017 where we had to reduce spending on multiple programs. I appreciate, again, Senator Baldwin's help in determining priorities, deciding how best to allocate limited resources, and practicing restraint regarding new riders as we work towards a common goal. Our bill provides an increase of $943 million for the National Institutes of Health. This funding fills a hole in Cures funding from last year for the Cancer Moonshot, Brain Initiative, and the All of Us research program. We also provided targeted increases for research in specific areas such as Alzheimer's, and Senator Baldwin mentioned these, mental health, opioid abuse, cancer, including funding the Childhood Cancer STAR Act. Today's bill builds on our efforts to fight the growing prevalence of substance use disorder, particularly the opioid epidemic. People of all walks of life in my state's been particularly hard hit. From urban and rural areas, young and old, rich and poor, have been affected by opioid abuse. The bill provides $5 billion in funding for opioid treatment, research, prevention, and recovery programs. The bill takes a multi-pronged approach towards efforts to slow the opioid epidemic, including a $1.59 billion for the state opioid resource grants to address the opioid epidemic in ways that suit individual state needs, $2.50 for the substance use prevention and treatment block grant, $655.5 for the NIH helping to end addiction long-term, and the NIH HEAL initiative. The Labor HHS bill prioritizes our children, starting with early childhood education to ensure children are ready to learn when they enter school, and continue investments in students in high school and college to make sure they are prepared for jobs today and in the future. Specifically, we increased to $700 million for Child Care and Development Block Grant and $275 million increase for Head Start, both to support early childhood education. $175 million increase for Title I schools to support students in low-income schools. $175 million increase for IDEIA, which provides special education services for students with disabilities, and $250 increase to the $250 increase to the maximum Pell Award, for a total of $7,645 for the 24-25 school year. Finally, the bill continues all longstanding riders and includes no new controversial riders. Now I'm going to briefly re-thank the staff because I think we can't thank them enough. So on my staff, Lindsay Seidman, Ashley Palmer, Emily Slack, Tom Pfeiffer, Ann Tate Hall, J.T. Jazurski, Dana Richter, and Addie Basali. And on Senator Baldwin's staff, Mike Gentili, Mark Leish, Megan Mott, Catherine Tumajan, Kelly Brown, and Abby Laver. And to Clint Trujillo and Ben Hammond and the wonderful GPO team, Valerie Hutton, Elmer Barnes, Karen Thames, and Penny Miles. Genuine thanks to all of them. Thank you again to the chairs, and I look forward to seeing the passage of this bill. Thank you.
Thank you so much. Senator Baldwin?
Thank you, Chair Mary. I have a manager's amendment that I would like to offer. It is being circulated right now. It has been negotiated with Senator Capito and has been cleared on both sides. Noting that Senator Feinstein is not able to be here for this vote, I wanted to simply acknowledge her strong advocacy for an impact aid eligibility issue for a school district in her state. I know that it's a very important that this issue gets addressed. There are several other impact aid eligibility issues that I know other members are very interested in seeing addressed, and I hope this can all get done in a comprehensive way as similar issues have been addressed in the past. There is report language in the manager's amendment expressing that intent, and I hope that the substitute can be adopted by a voice vote.
Is there any discussion on the manager's amendment? Seeing none, all those in favor say aye.
Aye.
Opposed, nay. Ayes have it. The managed amendment is agreed to. Are there any members who wish to offer an amendment or speak to the bill? Seeing